a lot of people at times struggle with some components of this particular subject. So we're going to get right into it. It's entitled Adults with Developmental Disabilities. Adults with Developmental Disabilities. And you may ask, why are we conducting this class? Because it's a major MCCQE1 objective, okay? And that is exactly what we are doing. So you're welcome. You're welcome to the class. Let's get the ball rolling. Now, the rationale for this class is that the need for healthcare for adults with developmental disabilities is growing, okay, because of greater social integration and accessibility and longer life expectancy than in the past. Now, these patients may have complex health issues and poor health status. So that is the rationale for this particular topic. And then it goes on to list causal conditions. And so if I am studying for this exam, what I'm going to basically do is to look at the causal conditions, unknown etiology. Number two, known etiology and associated conditions. So for example, patients with genetic syndromes like trisomy 21, autism spectrum disorder, right? Fetal alcohol spectrum disorder, brain injury and cerebral palsy, and central nervous system infection, especially central nervous system infections like meningitis, encephalitis, brain abscess, right? And others. So if I was the one preparing for this exam, what I would basically do is look at these causal conditions and associated conditions and make sure that I am mastering them one by one, because it is in the objective, right? The objective is stating that. So that's exactly what I want. Okay. Now, the key objectives. Given an adult patient with developmental disability, the candidate will identify common physical, mental, and behavioral issues and initiate an appropriate management plan. Then particular attention should be paid to the known disparities in health status and healthcare for this group, and to the interdisciplinary condition or coordination of care. It is also important, okay? This is also very important. It says, it is also important to adapt communication to the patient's level of intellectual and adaptive functioning. And so you realize that if you look at even this key objective, some things should come to you. It says, particular attention should be paid to the known disparities in health status and healthcare. So you should be thinking, okay, if I have somebody with fetal alcohol syndrome, if I have somebody with Down syndrome, what are the screening tests I need to do for this patient? What are the follow-up tests I need to do? It may be that the test I need to do for this patient may differ a bit from that of the regular population. This is what this particular paragraph means, right? So when it says particular attention, so that means the candidate must put a lot of emphasis on that part. Good. Now, the enabling objective says that given an adult patient with developmental disability, the candidate will, number one, listen and interpret critical clinical findings, including assessed level of intellectual and adaptive functioning. Number two, atypical presentations of serious illness and or pain. And number three, identified risk factors for abuse and neglect. So with the third point, you realize that there is a whole objective as well on domestic abuse, elderly abuse, child abuse. And so what I would suggest is that take your time and look at that very well. So there is a whole objective like that entitled adult abuse, okay? So this is where the issue of abuse and adults with disability meets. So if you're going to master that particular third point, know that there is a whole objective which you also need to master so far as abuse is concerned, right? Identified risk factors for abuse and neglect. That's very important because there's a whole objective on that topic. And this particular objective for adults with this developmental disabilities also talks about it. So that is very, very important. Okay. Then listen, interpret critical investigations depending on the disability. For example, tiotropium, stimulating hormone in trisomy 21, hearing and vision testing. So you see the various things the objective is linking that you must master. These are the things you want to focus. Then construct an effective initial management plan, including assessing the patient's ability to give voluntary and informed consent. So this comes under ethics, right? Who qualifies to give consent? Can somebody with fetal alcohol syndrome give consent? Can somebody with Down syndrome give consent? Can somebody with brain injury, secondary to meningitis, give consent? These are the nuances you want to master. And obtaining input and assistance from caregivers and initiating interdisciplinary care if necessary. So, for example, you have somebody with a particular developmental disability and the person is an adult. Which disciplines must come together to help manage that particular patient's condition? These are the things I want you to start looking at because they are very, very critical, right? Okay, good. Then performing appropriate screening and preventive measures, example, for infectious diseases and cancer, and ensuring appropriate use of psychotropic medication, for example, antipsychotics, including discussion of risks and benefits, and then anticipating medium-term and long-term complications. So if you pick somebody with, again, fetal alcohol syndrome, what are long-term complications? Somebody with Down syndrome, what are the long-term complications? Somebody with cerebral palsy, what are the long-term complications? This is what the objective is about. And that is why I'm saying all the time that it is not necessary to just say that, oh, I'm just reading this book. You can read all the books in the world that you want. However, make sure that whenever you are reading any book, that book is addressing all these. Better still, if you want to prepare effectively for this exam, why not choose a program which will even make this easier, like MedCognito, because we've dealt with all these objectives step by step by step by step by step, and then obtaining assistance and input from caregivers and support workers. So now, let's get ready to rumble. One of the critical objectives you needed to master is Down syndrome. So we're going to spend time to make sure that we've mastered this particular objective so that you can deal with it anywhere, anytime.